7 incidents in less than 24 hours. That only scratches the surface on the issue of gun violence within the city of Green Bay. In 2021 alone, 79 cases of shots fired were reported, compared to 18 cases in 2018.
This is not characteristic of who we are as a community, and so it's not something that we will tolerate going forward.
Green Bay Mayor Genrich says the city has a plan to combat the problem. In the short term, the city plans to respond with additional resources in the form of a neighborhood response team.
Well, it will be a patrol-based, dedicated resource, so it'll be officers who are not required to just go answer radio calls in a patrol district. And their job will be to go out and try for, first of all, to build some relationships in the places and in the groups in the community where we're seeing these issues.
Genrich says the city will also move forward with recommendations to invest American Rescue dollars in community safety resources at the next Finance Committee meeting. Some of those recommendations include gunshot detection software and resources to devote to recruitment and retention.
Because obviously we understand this is a workload issue as well, and doing everything we can to get fully staffed up.
According to the Finance Committee agenda, the total amount requested is about $971,000. The Green Bay Police Department says this is their highest priority, and they are working as hard as they can to keep people safe, but they're asking the community for extra help in doing so.
We really need you to let us know every time there is an incident involving weapons. And so it's really important for us to know when these happen, so that we're able to respond, to look for evidence, and again, keep trying to piece together this bigger picture of what is happening.
As fantastic as our officers, our law enforcement officers are, this is really a community problem. We need residents and neighbors and businesses and elected officials all to step up and do our part to resolve this situation.
It's more than just reading, writing, and arithmetics. The classroom is a place for students to learn lifelong skills. Some skills that can't be taught from behind a computer screen.
They haven't been around peers. They haven't been around, everyday stressful events that have allowed them the time to practice those skills or develop them.
Mental health professional Lana Cheslock says the pandemic has taken a toll on school-age children.
They're not as equipped this year to identify situations that would cause drama or increased anxiety for themselves. Going to school has become much more of a difficulty for kids. That increased isolation has caused a greater sense of social anxiety, of leaving the home, having to deal with peers, having to attend class.
Cheslock says they are also seeing a much higher need for counseling. Jerry Nicholson with the Unified School District of De Pere says this school year has brought a new kind of stress to students and staff.
You're navigating teacher shortages, bus driver shortages, and those types of things.
Nicholson says the district's focus is on meeting students where they're at, socially, emotionally, and academically.
Maybe set the curriculum aside for a moment and start to focus on accelerating their skills as a learner, and then using that then when we shift to curriculum to accelerate learning overall.
Nicholson says a big part of it is listening to their community, their students, and their staff.
Before we get to Omicron, let's start off with case numbers, hospital numbers. Where are we at locally?
I think locally, all the health systems continue to be extraordinarily busy. We have some record number of people in the hospital. COVID-19 patients seem to account for about 20 to 25% of the total number of people in the hospital, and somewhere around 50% of the ICU capacity. And again, the predominant people who take up hospital capacity for COVID-19 are unvaccinated. In the ICU, it's either 100% or close to 100% of people have not been vaccinated. And all of this is just only about 1 in 3 adults in Wisconsin who have not been vaccinated against COVID-19 so far. So there's a very clear disparity between those who are vaccinated and not.
And as we're finding out more about the Omicron variant, what have you learned about vaccine protection against the virus?
These are the buzz questions that we have right now. People should remember that it was just about a month ago that the first sample was collected. That eventually went on to be recognized to be what is now called the Omicron variant. So we have not had a lot of time to really good studies to understand how this variant behaves compared to predominantly the Delta variant that we see currently. Studies, though, are suggesting that vaccination has some of protection against the Omicron variant. It likely is not going to be as strong as protection as we see against the Delta variant. And the Delta variant, as we all know, didn't have as strong of protection as we did against previous variants that were out there. So the big questions that are going to remain are, how seriously ill does the Omicron variant make people? How easily transmissible is it? And exactly what degree of protection will previous infection and vaccination confer against this variant?
Have you heard of any cases here in Northeast Wisconsin of the Omicron variant? And if not, do you think it could be here, or how soon could it be here?
I have not heard of any local cases up here yet. There is a lag period behind the test is taken and when the results are reported by the state for these variants. I would not be at all surprised if there is not a case or so circulating around our area. But that remains to be seen. And for our purposes, delivering care to people in the emergency department and in the clinics, it really doesn't matter if you have the Omicron variant or not. It doesn't really change anything about the care that you receive and the therapeutic options that are available for you.
Okay, there's new information about booster shots. They've been approved for 16 to 17-year-olds. Are there any risks that parents should be aware of?
So at this point, vaccination continues to be extraordinarily safe. We're quickly approaching 500 million doses of the vaccine given in the United States. And again, we see incredible protection conferred to people who have chosen to be vaccinated at this point. Probably the most potential serious risk for kids in this group is something called myocarditis or pericarditis, or that's some inflammation of the heart. This has been shown to be extraordinarily rare at this point, and cases are typically very, very mild, and kids completely recover from it. It's so rare, though, at this point that the benefit of getting vaccination and the impact that COVID-19 can have on young people, which, as we know, is less frequent than in older people, that risk of COVID infection is still greater than the risk of vaccination. And that is why, at this point, the FDA and CDC have recommended vaccination in those groups for these kids.
Do you think, doctor, that there will come a day that we all get the same vaccine? We have so many decisions to make about which ones, and they're not all the same amount of doses. Do you think there will come a day when we all get the same one?
I don't know what will happen. I think at this point, I'm actually happy that we have options and we have different things that we know are effective. I would much rather have multiple options than have no options at all. And as we move forward and things change and new variants come about in the future, having different options and studies to understand which one is going to be most effective, is really going to be a great service to the American people.
Wisconsin's top health officials said this week that 270 healthcare facilities have requested staffing help. What are you seeing at Bellin?
We are short-staffed. I think every hospital in the state is probably short-staffed at this point. But I think I hear a lot of questions about, are we short-staffed or are our hospitals just full? I can say that our hospital is completely full. We have people doubled up in rooms if they are not infected with COVID-19. Some days we use beds in our emergency department to keep people there prior to moving to rooms upstairs. There's always questions of creating new space to put people in. So our hospital is very full. We have record numbers of people in our hospital seeking care at this point. So even though we are short-staffed, this is really more of a space issue, a degree of the number of people who are sick. We have a 20 to 25% increase in patients needing hospitalization right now in our region due to this COVID virus. And on top of that, with some constraints that we had with staffing even before the COVID-19 pandemic began, puts us in a really challenging situation.
And speaking of that, have you had to turn any patients away because there's no room?
I think that this is a statewide problem at this point. As an emergency physician, sometimes I need to refer patients outside of our health system just because they don't have the specialists that they need. And there's been times where I've called 12 or more hospitals trying to get the patients the care that they need without any access. At the same time, we have people who either want to be transferred to our hospital or ambulances who want to bring people to our facility. And we're not always able to accommodate those requests due to space issues in our healthcare facilities. So I think this is a problem we've seen all across the state where hospitals at any given time might not be able to take on more patients.
Can you give us some insight into mental health? We've talked about this before, about your staff being overworked, and also what about patients? Are you seeing more with anxiety?
Yeah, I think, the most challenging thing right now is uncertainty. Anytime there's uncertainty about what the future holds, are you going to have effects and aches and pains and a fever the day after your vaccine? How are you going to do once you get COVID? Are you going to be a patient who doesn't do well, or are you going to do relatively well? I think that causes a lot of anxiety for everyone. And then for healthcare providers delivering care, I think, just knowing how is it going to be at work that day? Is it going to be an extraordinarily busy day where you don't really get a break to sit down or have, a cup of coffee? Or is it going to be a day where, you get those breaks that you really want to have? That uncertainty, I think, makes things really challenging. I also want to add just to the last question that, we really fear that when we talk about how busy hospitals and healthcare systems are, that people are to not seek care when they feel that they need it. And people should not feel that way at all. If you come through our front door, our emergency department is always open and might be extraordinarily busy, but you will see a triage nurse who will possibly get lab testing going if it's felt necessary, and we'll get your care underway so that we can take care of you. So if you feel that you have an emergency, please seek healthcare via whatever avenue you feel is most appropriate at that time, and don't delay things, because we are experiencing that people do delay and they end up sicker and they require hospitalization longer. So if we can prevent illness, or if we can take care of things sooner, we definitely want to do that at this point.
And finally, as we approach the holidays, how should families handle get-togethers?
The number one thing that I want to say at this point is that if you feel like you have a sinus infection, you have a cold, you have a little runny nose, you have a sore throat, you feel under the weather, just be really cautious. There's been so many patients that I have seen that said that they had either gone out, to work, to family events like this, and ultimately were diagnosed with COVID-19, or they had family members or friends who exposed them thinking that they just had a cold. That's probably the best advice I can give at this point. Certainly masking and distancing and vaccination are probably the other keys to talk about, but I think that the behaviors that people are probably going to have at this point are probably pretty much set in stone, and people probably aren't going to change whether or not they're going to follow those guidance coming up at the holidays.